This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue
As
opposed to
second.
health first or
Medical Dilemma.
Hi, I'm Sonny Rosario, and you're tuned in to Medical Dilemma. Once in a while, we feel sad or blue, but such feelings are usually short-lived, and we frequently bounce back in just a few days. For others, sadness may become sick and deep. Consequently, it interferes in their daily lives, causing pain for both them and those who care about them. To help us understand depression, we have a specialist in psychiatry who's chief of the section of psychiatry of the Makati Medical Center, Dr. Lovie Hope Gochu. Welcome to the show, Dr. Gochu.
Hi, Sunny. Thank you for inviting me to your show.
It's an honor to have you on the show, Doctor. Now, let's first talk about depression in general. You know, as I said earlier, people really suffer from bouts of, sadness or being blue once in a while. But what makes depression different from these usual spells of sadness?
Yeah, you're right kasi depression, sometimes we use depression left and right. I'm so depressed, wala akong pera. I'm so depressed, bumagsak ako.
Yes,
you know. Those are, depression as a normal, reaction to a situation. Usually, kunwari pag bumagsak sa test, malulungkot. After a few days, you're okay. You go back to your functioning, etc. However, clinical depression or major depression is an illness. That is when, for example, the patient would experience, feeling very sad. Okay. They don't want to engage in their usual activities. Sleep is affected. Either they sleep too much or they cannot sleep. Their food intake, sometimes ayaw nang kumain. Sometimes sobrang kain ng kain. They cannot concentrate on work. They cannot focus on school. Sometimes it gets really so bad that they have thoughts of killing themselves. That is clinical depression. If the sadness is so deep that, they're functioning already, that their relationships are already affected, then that is, something that has to be treated already.
This is something I think most people don't understand, that depression is an illness. So when you say illness, there must be some, physiological defect, if you can call it that, present when a person is depressive. Is there something like that?
Yeah, kasi we always say depression, as with everything else in psychiatry, is always biopsychosocial.
Psycho and social.
That's right.
Okay.
Biologically, there's some in the chemicals in the body, like some derangement in the chemicals. Kulang ka na certain chemical, so kaya you become depressed, or sometimes there's a genetic predisposition. Pag mataas ang family history of depression, then there's a likelihood that your children will have depression also. That's the biological part of it. But it's not just biological. You also have psychosocial. For example, yung mga coping mechanisms mo.
Yes.
Like if a loss happens to you, how do you process that loss? How do you cope with mga losses? That's a psychological part of it. And then there's also the social part of it, which is, our social environment. Things would happen that we would get stressed, things maghihiwalay with, somebody with a loved one, there would be death in the family, etc. All of these could precipitate, depression. So it's always a combination of biopsychosocial in depression.
Now,
but definitely there is a biological component.
There is a biological component.
That's why they respond to medications.
Okay. Now, are there types of depression?
Yeah.
Other categories?
When a patient comes to us, first we want really always to make sure that the depression is not coming from a medical cause. Okay. Meaning, let's say, for example, a patient has hypothyroidism. Hypothyroidism can cause symptoms that mimic depression. Parang walang kagana-gana, they don't want to, they're so lethargic, they don't want to go out. Sometimes that can be misconstrued as depression. And then you take the thyroid function test, ayun pala, hypothyroid lang. You treat the hypothyroidism and it goes away. Yeah. And sometimes, as we were talking before, sometimes pag pancreatic cancer, sometimes the only manifestation could be depression. So it's very important, really, to first rule out any medical cause, because these treat the medical cause and then the depression goes away. So that is one kind of depression, secondary to medical cause. Sometimes depression could be a normal variation of mood. I just feel sad now. I don't feel like doing this. I'm just bored. That's not clinical depression. You find something to do, and you're not bored anymore. Then you're not depressed anymore. And then, of course, sometimes it could be an adjustment to a life situation, as we were talking about. Kunwari, kapag nakipag-break sa boyfriend, bumagsak sa test, of course, they will be sad for a time, but then after some time, pag naiyak na, babalik na ulit, magde-date na ulit, babalik na sa school, then that is just a normal reaction to a situation. Pero of course, what is of concern to us is yung depression talaga. That is clinical depression. Ito tinatawag na major depression talaga.
Major depression. Okay. Now, is depression something connected to the upper classes of society? Because a lot of people think it's like that.
No. Baka kasi upper classes.
It's because they see, the rich people that go to the psychiatric wards or that seek psychiatric treatment.
Maybe because nga they have the means to seek treatment. But really,
so it's a misperception.
It's a misperception. We see patients from all walks of life.
All walks of life.
And kapag even if you cannot afford, let's say, to go to a private psychiatrist na mamahalan ka o kung ano, almost all the major hospitals would have like yung parang yung mga service programs. Like in Makati Med, we have like the health service programs. They just go to the HSP section. They can be seen by a resident in training, and that the work of that resident is being supervised by the psychiatrists, by the attending psychiatrists.
Well,
so it's
good
not
news for our people who
definitely
are not able to afford.
They have to seek consult because it can be very debilitating on depression. So they seek consult at the soonest time. The soonest that we treat it, the better for depression.
Okay, what are the longest? In terms of time period, what are the longest depressive states that you have encountered?
Well, they say na kapag let's say, an untreated episode of depression may last like, sometime between 6 to 9 months, 6 to 12 months,
6 to 9
untreated. Usually, pag under treatment, maybe in 3 months' time, that would be treated. But of course, we sometimes yung may mga tinatawag na parang treatment resistant, parang medyo matagal talaga. I would say mga 70% of patients would respond to treatment. The 30% you'd have to like find like combo ng mga gamot, psychotherapy, etc. etc. Sometimes may mga patients na pag sobrang tagal, usually pag ganun baka may mga personality issues coming into play already. For example, pag merong mga gains by being depressed and they would not be expected to do certain things, So kapag ganoon, parang may gains na yun. So kapag medyo mas matagal, mahirap talagang gamutin pag ganoon. But in general, I would say, mga 2 to 3 months, the depression should be under control na.
Can depression take years before it goes away?
Depende nga kasi sometimes kapag treatment resistant talaga.
Treatment resistant.
Sometimes they would respond a little lang, pero not totally goes away like all of the symptoms. Pag ganun, then of course you never stop trying. Kasi kapag after medications, may mga may mga iba-ibang levels, pag hindi mag-respond sa medications and psychotherapy, usually combination medication psychotherapy. Pag hindi mag-respond, sometimes we have like yung mga biological treatments. Like for example, we call it mga electroconvulsive therapy. Yung mga electroconvulsive therapy, usually kapag parang very, very deep depression, tas mas mabilis for the symptoms to go away. Mga ECT, pag hindi pa mag-respond, then sometimes we just have to help the patient cope so that kahit na papaano mag-function pa rin sa everyday life, even if the symptoms don't go away totally.
Can one die from depression?
Not die in the sense na parang mamamatay ako, let's say, because I have an overwhelming infection in my brain.
Yes.
Not like that.
No.
But kasi kapag depressed, there's a high possibility of suicide because it gets to that point
so
sometimes.
Suicidal tendencies.
Pwedeng magkaroon ng ganon. And of course, if you're depressed, and sometimes higher yung higher yung risk mo to have like heart disease, all of these medical comorbidities may increase if the depression is left untreated.
Okay, so once you've diagnosed a patient to be suffering really from a depressive state, so what is your strategy for managing the illness?
Okay. Depends kasi. Kunwari, if the depression is just like, as we're talking about, like yung parang life adjustment difficulties lang, yung mga ganon, nakakapag-aral pa naman, nag-work naman. Sometimes, psychotherapy, which is parang talk therapy, trying to find solutions to your current problems, trying to help you adjust. Sometimes psychotherapy would suffice. Sometimes there are patients who cannot tolerate medications, then psychotherapy would suffice. Sometimes we would combine psychotherapy and medications. Tapos, usually that's how we manage. Tapos pag talagang hindi pa, you can go to like mga brain stimulation strategies na.
Brain stimulation
Yun yung mga
strategies.
electroconvulsive therapy, mga transmagnetic cranial, mga medyo mas na yun.
I see.
Mas invasive na.
The medications that you use, are they addictive?
Not at all, not at all. But of course, as with all medications, we want to taper. Kasi kunwari, kapag matagal lang tinitake, tas biglang itigil, they can have like mga discontinuation symptoms. Yung parang babalik yung symptoms, parang they get more agitated, may headache, etc. So we just like taper it, but they're not addictive at all. Hindi yung tipong hahanap-hanapin ng katawan mo.
I see.
Hindi ganun.
So these medications are different from those things that we call uppers,
Ay,
the kinds of things that circulate in the clubs.
Ay,
in
no,
the
no, 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 no,
discos,
no, not at all.
Not at all.
Although, sometimes patients would self-medicate. If they're like depressive, na parang malungkot, gano'n, na
Yeah,
parang
so
parating,
they take
sometimes
stimulants.
they would take stimulants to self-medicate. So that's why it's very important that they're aware if they're feeling depressed, so that they seek the proper treatment and not just like take poppers, pop uppers right and left just to deal with the depression.
I see. Okay, thank you so much, Dr.
Yeah.
Gochu. Okay,
Thank you,
we'll have a
Sonny.
pause at this time. Don't leave this channel. We'll be right back after a few words from our sponsors. That's the first segment.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?